Welcome to Dr. Deane's webinars on healthcare, and today we're going to ask and answer the question, what would a good doctor do? My name is Deane Waldman. I'm your host, and for those of you who are new to these webinars or don't know me, I'm an emeritus professor of pediatrics, pathology, and decision science. Currently serve on the board of the New Mexico Health Insurance Exchange, and am the author of the book, The Cancer in the American Healthcare System. In this webinar today, we are going to look at our healthcare system as though it were a sick patient. And we're going to ask some questions like, what would a good doctor do for this patient named healthcare? What are the root causes of the patient's sickness? That's patient healthcare. What are the effects on us individually and on our country of those root causes of sickness? And finally, of course, what should you do? Now, a good doctor, when he approaches a patient, uses the four basic principles of good medical practice, which I abbreviate PENT. The first one is to make a partnership with the patient. The second, E, is to use evidence in making recommendations so that the patient can make an evidence-based decision. The third is what I call net long-term cost-benefit analysis, and by that I mean the cost as in money, long-term, the cost as in risks, and the benefits that the patient will receive from whatever you decide together to do. And most important, T stands for treat the root cause of the patient's illness and not the signs or symptoms. This is all laid out, and I urge you to read it in that book called The Cancer in the American Healthcare System. Now, let's start with a P, partnership with the patient. A good clinical doctor who actually forces a treatment, a pill, therapy on an unwilling patient, well, that's either assault and battery, or frankly, if you try to operate on a patient who's not willing, you're actually guilty of attempted murder. Now let's look at Washington, Dr. Washington, with their treatment of the patient called Obamacare. Frankly, they forced it on an unwilling patient. This is the only legislation in U.S. history, that major social legislation, that was passed with one party and not a single vote of the other party. National polls have consistently shown that the American people resent and, quite frankly, don't like and are afraid of this treatment, and it has been business as usual for Washington instead of good medical practice. A good doctor uses evidence. For example, medical standards require a good doctor to show the patient that there is hard evidence before giving a medical recommendation. You can't just say, I think you should do X, without saying, the literature shows that 96% of patients who did X got better, the patients with your kind of problem. And frankly, good doctors do not make a recommendation if they don't have some evidence to support that recommendation. Now, what about Washington with Obamacare? Was any evidence ever presented that showed that it had worked in the past? Frankly, as we all recall, then Speaker Pelosi said we need to pass it to find out what's in it. So they didn't even know what they were doing when they did it to us. All we had were hope and some really wonderful promises, but the available evidence, which is there, was, to be blunt, unflattering, or quite frankly, suggested in advance that Obamacare wouldn't work. A good doctor does net long-term cost-benefit analysis and presents that data to a patient. So, for example, suppose you needed a hip replacement. The orthopedic surgeon would say, well, this type of device that I think is the best for you has the following failure rate. Now, it may only be 2 or 3%, but the patient needs to know that. The recovery afterward will take 3 months, 6 months, whatever it'll take. Hopefully, the benefits you will receive patient for after hip replacement include an improved range of motion, pain-free walking, ability to spend more time on a treadmill or climbing stairs or doing things that you want to do, playing tennis, riding a bicycle. If it were heart surgery, the surgeon would say, patients in your risk category, the likelihood of survival is whatever, hopefully very, very high. Those who have problems after surgery, these are the kinds of problems you might anticipate, and these are the benefits that you will get. That chest pain should go away, you should have more energy, hopefully you will live longer. Certainly the evidence shows that patients after the surgery live longer than patients who don't have the surgery. Those kinds of things. Now, what did Washington say to us regarding the cost benefit for the Affordable Care Act? Was there evidence of cost? Well, I don't know about evidence, but they had an estimate, which was initially a little over $800 billion. Then it was 1.1, then it was 1.6, then it was 1.9, and the latest is $2.6 trillion, and that's all estimate. There's no evidence. As for long-term, nobody would talk to us from Washington about the effects on the economy, about the effects on our wallet, other than the $2,500 which we were supposed to save, which, as you know, didn't materialize. As for evidence of benefits, that's worse. The fact is, there was no proof of any benefits that would accrue to us. And in fact, there was no quantification. It was just, this is good for you and we should do it. And that's not good medicine. Now, finally, a good doctor treats causes, not symptoms. Imagine a patient comes in with a headache. Do I just give him a prescription for morphine and send him home? Of course, with his bill. What if I only treat the symptom and he's got a brain tumor? Well, the answer is a good doctor will do what's necessary to find out the cause of the patient's illness, in this case, a headache symptom, in this case, a headache, and treat that cause, because that's the only way that you can cure a patient. Dr. Washington, with the Affordable Care Act, forced the therapy on the patient. There was no evidence that the Affordable Care Act would actually make us healthier. There was no long-term cost-benefit data. And what really scares me is that they might have known the root cause and chose to ignore it or simply reject it. And that is what we're going to talk about in a second. But the conclusion that we're going to have to come to is that Washington simply did not behave like a good doctor in its care of patient health care. The root causes. Okay, why is patient health care sick? Well, first, we have the whole third-party payment structure where the consumer of services and the seller of services are disconnected by a third party called the insurance company, or, frankly, the government. There are no free market forces, and they interact with each other, the third-party payment and no free market forces, because there's no reason to economize, and there's no competition between sellers, no real competition. There's perverse incentives in healthcare, which again interacts with the lack of free market forces. We actually reward the very outcomes we don't want. Patient gets sicker, and the doctor gets paid more money, and the hospital makes more money. All of this is based on overregulation and excessive central control, which basically causes all the other root causes of healthcare sickness, and that is explained in great detail in The Cancer in the American Healthcare System. I urge you to read it. Now, what are the effects of those four things that we just discussed: third-party payment structure, the perverse incentives, the regulatory burden, and the lack of free market forces. They produce the three basic symptoms of patient healthcare sickness. We spend too much nationally. We as patients can't get the care we need when we need it. Just ask an American veteran in their single-payer system called the VA. And we can't afford the care for sure, and quite frankly, we can't afford the insurance. What is happening is all of those causes are causing all of those effects. And until we do something about treating the causes, we're stuck with the effects. Finally, what should you do? Well, the first thing I urge you to do is to visit the free website wecanfixhealthcare.info, not .com, .info, and consider the information on that website. There's lots of good stuff there. I urge you to look at some of the other webinars, and the easy way to get notifications are just to go to that URL. You can write it down and just go there and sign up. Finally, I urge everybody to read The Cancer in the American Healthcare System, because it not only tells you what's wrong, but also tells you what you need to do to make it right. This is Dr. Deane. I look forward to discussing with you at another webinar. Have a great day.